I'm Graham Swain. I've Patrick Oliver with me. Patrick, I want to ask you about Cauda Equina. What is Cauda Equina? What does it mean?
Cauda equina first is a Latin term, which literally means horse's tail. And it refers to a structure of nerves which actually, if seen on a scan, resemble a horse's tail. People who suffer from this syndrome are people who have suffered from a long-term chronic back pain.
What a red flag symptom?
Red flag symptom is a symptom that should be flagging up to the GP or to the doctor. Something is very seriously wrong here. The symptoms can be life-changing if they go untreated and no surgical intervention takes place. They can result in permanent and catastrophic injury in these patients, including in extreme cases paraplegia.
How quickly should the GP act?
If surgery, broadly speaking, is performed within 24 to 48 hours, there is some dispute as to just how long that period ought to be. But if surgery is performed within that time frame, quite often function that has been damaged can actually be restored, at least in some degree, maybe not completely.
These are life-changing injuries.
Well, the consequences can be extremely serious. Usually it will result in permanent injury. In extreme cases, it could result in paraplegia. Quite often, patients are left with numbness and pain in the legs. They're often left with numbness in the pelvis, sexual dysfunction, and sometimes incontinence of urine and incontinence of feces. It's absolutely horrendous. And unfortunately, the injuries are permanent and they have to cope with these injuries for the rest of their lives. I am working on several cases at the moment and have worked on cases where patients have presented to a GP with a range of these symptoms and they're simply ignored, given painkillers or anti-inflammatories and sent on their way.
What should a GP be looking for?
The diagnosis really lies with an orthopedic surgeon, and that is why the GP must refer to hospital for a proper investigation to be done.
How do you work out what a case is worth?
What we can say is that if the injury is serious and if we can prove the case, the compensation is likely to be substantial. But it's very difficult to get into the technicalities of the likely compensation until we know more about the case, what consequences are attributable to the defendant's negligence.
If someone has concerns about their treatment, what should they do?
We always talk to our clients initially on the phone. Quite often they ring in with their inquiries, and if we think the case is meritorious, we arrange a face-to-face meeting. If the client is suffering from a severe disability or has transport issues, which often accompany severe disability, we're more than happy to get to them face-to-face, sit down, talk it through with them, and go through the options with them. One of the first things we will do after we commence an investigation into a case is sit down with the client and key family members who may have been involved in the incidents in question and to take detailed witness statements from them while the events are fresh in their minds. I hope that when things like this happen and when trusts are forced to investigate these things and seek legal advice, that the first thing that they do is to look at their own systems and see, my goodness, why did this happen? How can we prevent this from happening again?